Patient walks into the room. He tells you about his symptoms. As a doctor, you use all the medical knowledge and help him. You believe he is happy and chirpy. Are you sure? Let's break the ice. I'm Dr. Deepam Dash and you're watching Matters That Matter. Today we'll look at these 4 fundamental questions when explaining about ice. What is the number 1 barrier in consultations? What does ice stand for? How to ask questions pertaining to ice? Should you be using ice in all OSCE cases? A patient is not just a complaint box who will reveal to you what you need to hear, nor are they gadgets. They are humans. That's why interpersonal skills are also crucial. It is a skill whereby you can show how respectful, patient, attentive, and empathetic you are towards your patient. It is one of the 3 domains of assessment in many OSCEs, as well as for PLAB. You may pause and take a note of this slide if you wish to.
The doctor didn't ask, no tell. It's not important. Should I tell the doctor I have many sex partners? Will he judge me?
This is too embarrassing. I can't show her the acne.
Should I go to the doctor for this line on my nail? Won't it be useless? Can my daughter get it from me?
Ice can make your consultation free-flowing and help patients bring up the questions they want to ask you. If you put yourself in the patient's shoes, you will find out about their fears, confusions, disbelief, and many other emotions which might hamper their diagnosis and treatment. You don't need to be a psychiatrist to be able to do so in many cases. ICE is the answer. What is ICE? I for idea, C for concern, and E for expectation. An idea refers to the patient's health belief. What they think is causing their symptoms, what might be the treatment for it, and what are the outcome that they feel could happen because of that health problem they believe having. How can you elicit the idea of the patient? You may ask them these questions. What do you think might be happening? Tell me about what you think is causing the problem. You have a very specific reason for your visit, which is that you're requesting for an X-ray. May I know why you wish to have an X-ray? Don't dismiss the patient without digging. Some investigations that patients request may actually help them. Allow the patient to guide you and ensure that the flow of questions is natural. If the patient starts speaking about the concern, explore that, and then you may go back to the idea and later to the expectation. Otherwise, you will sound robotic. Concerns are the worries of the patient. You may ask them, in your darkest moments, what do you worry about? What's your number 1 concern regarding this problem at the moment? Patient might even ask you, Doctor, how will I work? How will I drive? How do I explain this to my family? Coming to the E, that is expectation. Expectation is hope. What the patient hopes for. You may ask them, we are coming to an end of this consultation. Is there anything you wish to tell or ask me? Or you may say, what do you think might be the best plan of action? Were you hoping for me to do something that I haven't yet done for you? In that way, you might come to know about the expectations. Remember, when you're checking for idea, concern, and expectation, it need not be in the same order, so be very attentive to what the patient is saying. If the patient has already given you any of these components, do not go back and ask the same question, otherwise you will be marked in the listening skill. How do we do the ICE? Is first of all, don't be robotic. So when you're asking the questions, let the flow be there. It should be incorporated into your data gathering and management. Don't waste time in futile questions, otherwise you might lose track, or more pertinent questions might be missed. How much time you allow between the three questions is also important, because otherwise patient might snap at you and ask you, "You're the doctor, not me," and there you will lose the rapport. There's no negative marking for skipping ICE, but it definitely helps you have a smoother consultation. Sometimes you might be a little bit unsure about some stations, so it can help you navigate through those stations. Please note that a patient might not come to you because they are not feeling well. They might have been prompted by their family members to come to the doctor. For instance, you might have a mother who was encouraged by her daughter to come and have a checkup for dementia at the doctor's place. So you need to ask about the idea, concern and expectations of the daughter as well as the mother. So asking ICE tactfully will make it easier to structure your management plan, as you will be able to appreciate the patient's perspective and give them personalized advice. This was a brief video about ICE for OSCEs and the smooth flow in consultations. I hope you find it useful. This is a wrap up. For more medical content, like, subscribe and click on bell notification. You were watching Matters That Matter. Stay tuned and have a nice day. Thank you.